Welcome to the Registry Partners June 2024 Oncology Coding Break. As a QT manager, I often see some confusion on how to code the two SSDI fields for prostate, number of cores positive and number of cores examined. With this confusion, errors in coding are made. During the June Oncology Coding Break, I will talk a little bit about these two fields, provide some clarification on the use of code X6, positive cores, unknown how many, and walk through a couple of case examples reviewing the pathology report, final diagnosis, and pathology report gross description. The confusion tends to come about when you have a pathology report that gives a final diagnosis. The gross description on the path report doesn't line up with the final diagnosis, and or you have a discrepancy between the dictated physician procedure report and the pathology report. When coding these two fields, the pathology final summary is number one priority. A physician might state in his trust prostate biopsy report he took 12 biopsies, or however many were taken. But if you have access to the pathology report, this is where you should be gathering your information for coding. Also keep in mind, cores of other areas like seminal vesicles should not be included in the count. SSDI prostate section, number of cores examined, and number of cores positive, note 1, under the coding instructions and notes state, physician statement of number of cores positive and number of cores examined can be used to code this data item when there is no other information available. Using the physician statement should be a last resort when coding these two fields. So there seems to be some hesitancy when using code X6. However, code X6 is an applicable code and should be used when it applies to the case being abstracted. You would also use X6 when the gross description describes fragments, chips, or pieces. So let's take a look at a few examples. Here we have a 58-year-old white male who presents with an elevated PSA of 15.74. On physical exam, the DRE revealed perineum normal to visual inspection, no erythema or irritation, sphincter with good tone, rectum without hemorrhoids, fissures, or masses. The prostate is medium and smooth. There were no scrotal rashes or lesions noticed, and normal bilateral testes and epididymis. Transrectal ultrasound-guided prostate biopsy was recommended. Just as a reminder, it is important to document in your physical exam text the digital rectal exam findings prior to the prostate biopsy, or if a DRE wasn't performed or unknown if performed. At times, the DRE will be performed by the urologist prior to the prostate biopsy or at the time of the trust prostate biopsy encounter, so you do want to look for that information. So the patient underwent a transrectal ultrasound and echo-guided prostate needle biopsy. An endorectal probe was placed in the rectum. Transverse and sagittal images of the prostate and seminal vesicles were obtained and measurements were recorded. Using the needle guide on the probe, a biopsy needle was used to obtain biopsies of the prostate in a standard fashion. It's seen and abnormal lesions were targeted along with systematic biopsies from each side. Tissue cores were placed in formalin jars and sent for pathologic review. A digital rectal exam was also performed at this time, and the prostate measured approximately 40 grams and was without prostate nodule. The prostate capsule was normal. There were no hypoechoic masses, and the seminal vesicles were normal and symmetrical. The biopsy pattern was listed left-right, left lateral, and right lateral, with a core taken from each one of these from the base, the mid, and the apex. Here on the pathology diagnosis summary, you can see listed under 1, 2, and 3 all specimens that were taken and that were benign. Number 4, specimen L, states from the right lateral apex, there was prostatic adenocarcinoma, Gleason score 7, pattern of 4+3. with the Gleason's pattern 4 comprising 70% of the tumor and pattern 3 comprising 13% of the tumor. As you can see, the pathology diagnosis summary doesn't list the number of cores examined or the number of cores positives. Looking at the gross description would be second priority. So here is the gross description. As you can see, specimens A through L are listed out in number of pieces. You can see that there are pieces ranging from 1 to 5 within each one of these labels or containers. And you can see specimen L is malignant and there's 3 pieces. So the number of cores positive and examined will be coded. The number of cores positive will be coded as X6. The final diagnosis specimen L, right lateral apex, doesn't provide us with a total cores positive. And the gross description list for container L states 3 pieces. The number of cores examined will be listed as X6 or coded as X6. The final diagnosis doesn't provide us with a total cores examined, and the gross description lists number of pieces, and the number of pieces per container range from 1 to 5. Per SSDI prostate number of cores positive and examined, note 3, information from the gross description of the core biopsy pathology report can be used to code this data item when the gross findings provide the actual number of cores and not pieces, chips, fragments, etc. Case example number 2, we have a 65-year-old white male who presents with an elevated PSA of 6.9. Digital rectal exam revealed a 20-gram prostate with no nodule. Prostate biopsy was recommended. The patient underwent a transrectal and transperineal ultrasound-guided prostate needle biopsy without MRI fusion. No calcifications or concerning foci were observed within the prostate or seminal vesicles. The base of bladder visualized and without lesions. Under ultrasound guidance, the perineologic precision point system was then employed and 12 cores of the prostate were obtained. The pathology result final diagnosis shows specimens E, F, and L with adenocarcinoma, Gleason's 6, 3+3, with each having 1 core within each file. On the gross description, you can see that each specimen lists the number of cores within the specimens. So the number of cores positive, we see 3 from the final diagnosis, and the number of cores examined, we see 15, or count up as 15, as the gross description shows the number of cores within each specimen. Even though on the procedure report the physician indicated 12 cores were obtained, the pathology gross description lists 15 cores and not pieces. Because you have access to the pathology report for review, the pathology report results take priority over the physician procedure report of 12 cores obtained. I hope you found the June 2024 Oncology Coding Break helpful when determining the prostate number of cores positive and examined. Thank you and have a great summer.